Bismillahirrahmanirrahim. Welcome to Dar-e-Arqam School, Hori Town, Phase 1 campus. This video is about the training session of SOPs after school reopening regarding coronavirus. So let us start our today's video. SOP stands for Standard Operating Procedures, and we will discuss these SOPs in the light of school reopening both for the staff and students. First, we have to understand the most important thing about coronavirus. Our responsibility is to stop the spreading of this virus. We cannot eliminate this virus, and up to some extent, we cannot cure this virus as well. So, what we have to do is to stop the spread of this virus as much as possible. Now, we will study some more facts about coronavirus. One of the basic facts about coronavirus is this virus spreads from the tiny invisible droplets which comes out of the mouth, ears or nose of a sick person while sneezing, coughing, even sometimes talking, and in the form of tears while weeping. And if any healthy person accidentally get in contact with that virus and inhales that droplets, he can become a sick coronavirus affected person. So what we have, if we see someone visibly coughing, sneezing, or we feel him sick, so first most important thing which we can do immediately is to keep your distance from that person at least 2 meters to get safe from those invisible droplets which comes out of the mouth in case of sneezing or coughing. So one thing we have to keep in our mind is to maintain the distance, which is also used for that distance is social distancing. While we are socially in contact with some other person, with our friends or fellows or classmates or colleagues, we should be at the social distance of at least 2 meters. And we should provide the mask or tissue paper to that person who is coughing or sneezing to cover his face properly to make the people safe. It's a good idea to keep away from the crowds, because if you are in some crowd in market or any other place, you don't know that either there can be an affected person and this possibly symptoms are not clear. Maybe the affected person is not sneezing or coughing at that time, but he is an affected person, so he can cause other people affect. So it's a better option to keep yourself away from the crowds, and if you have to go and in any crowdy place, you should wear mask and do not touch your eyes, mouth, nose, and even the outside of your face mask until you get back to your home and you wash your hands properly. There are some other ways I will discuss with you from which the coronavirus spread can happen in normal routine days. Let us consider this person as a sick person. He is doing coughing or sneezing, and he is putting his hand on his mouth while doing coughing or sneezing. When this person touches the doorknobs without washing hand, or even if he is going to wash out his hands, but before going out of the room he touched the knob of door with dirty hands, the door is also a carrier of coronavirus. Now the doorknob is also the carrier of coronavirus. Same is the case if that person touched the pen. Pen is also a carrier now of that, because of those tiny droplets which are the carrier of that virus. In an office, if a person touches the mouse, digital devices such as mobile phone, tablets, laptop, tissue paper, all these things are very likely to be touched by a person who is affected person of coronavirus, and he is having that droplets and germs virus on his hand, and unconsciously he is touching all these things. We can relate this very easily. Lift buttons in offices, in shopping malls, cup, glass, stairs, and even the outside of the mask of a healthy person. So wherever these infected hands get touched, they keep on spreading the virus from clean doorknob to the outside of the mask of a healthy person. So the better option is, do not share your digital devices, your cups, your tissue papers, your stationery with any other person. And in school premises, we should keep on cleaning, disinfecting our doorknobs regularly within an hour or even less than an hour. And we should guide our students and staff that soon after sneezing, you should not touch anything at all. Just directly go to the basin and wash your hands. After thoroughly washing your hands, you can touch any other thing. And hands should be washed for good 20 seconds to get rid of that virus. And use soap to wash your hands. And if you touch the infected hands on your face, you can rub your eyes with infected hands unconsciously, you might do, then you might fall sick. So if you have any kind of encounter with a sick person, before touching anything on your body, on your face, or touching anyone else around you, you must wash your hands immediately. In general, do not touch your eyes, nose, and mouth. If we wash the surface or our hands with the soap properly, then we can get rid of that virus. So first thing, I will repeat again, the first habit which we have to develop in ourselves and our students during the school timings after school reopening, to wash their hands regularly under your own supervision. Which is why it is also good to follow these 5 precautions. Now we will study about the 5 main precautions which we must follow after the school reopening with our students, and also train them and guide them to follow this practice at their homes as well. Number 1, wash your hands thoroughly with soap and water for at least 20 seconds after touching a suspected contaminated surface. Wash your hands thoroughly means you should wash your hands in between the fingers, inside your nails, back of your hands, wrist, thumbs properly, and rub your hands with soap for good 20 seconds, and avoid the wastage of water. Do not waste water while you are rubbing your hands with soap. Turn the next thing is, you have to cover your cuff with a disposable tissue or use mask and discard them immediately in a waste bin. Don't wear the mask for more than 4 days. You should keep clean and disinfected tissues with you all the time. You should guide your students to have their tissue rolls, tissue boxes or hanky packs in their bags, and they must cover their face properly with the tissue paper even if they are not sick. Even then they should keep their face covered with the tissue paper when they are sneezing and coughing, and soon after doing the sneezing or coughing, they should dispose their tissue paper off in the dustbin and then go wash their hands soon after doing this practice. Or if they are wearing mask and they have sneezed or coughed on the mask, then after that they must not wear that mask and they should change their mask. Make sure that your students, they must keep an extra pair of at least 2 like mask in their bags. In case of any emergency or need, they should wear or use that. Number 3 is avoid coming into contact with people who are sick or share the personal items like food, utensils, cups, and towels. Personal hygiene is the most important thing, and you should discuss with your students about their personal hygiene in your classrooms before starting your lecture. Do ask them, have they taken bath in the morning? Have they brushed their teeth at night time before sleeping? Tell them to make the habit of brushing the teeth twice a day. Even tell them avoid the junk food, eat the healthy foods. In these simple tips, you should keep on discussing repeatedly with the students so that it will get stick in their mind that they have to take care of their personal hygiene even if they are not sick. Number 4 is avoid touching your eyes, ears, and nose. You should repeat this sentence again and again in your classroom with the students that they should develop this habit permanently of not touching their eyes, ears, or nose, because these are the sources from which we can get any kind of, not only the coronavirus, but any kind of infection outside, and we take that germ into our body through the eyes, ears, or nose if we touch them with a dirty hand. Number 5, seek the medical advice if you are sick. It's very important. If you feel sick, you should definitely consult your doctor. Do not take your sickness for granted, and do not prolong your disease. If you feel any kind of symptom, you should definitely consult your doctor immediately to get the. Stay safe, everyone. In school, your students should not contact for the greetings. You can use the elbow bumps, military, or you can do the simple hand waves. Your hands should not touch the hand of other person, your classmates, while doing any kind of greetings. Do tell your parents while you get back to your home after the school that we will not shake hands with you, we will not greet you until we change our uniform and wash our hands, wash our face, do the goggles properly, and after that you can meet your family, your parents, your siblings. Do guide your students before leave time, at least 10 minutes before leave time on the daily basis. You have to tell your students that soon after getting their homes, they are not supposed to meet with their family. First, they have to wash out their hands, their face, do the goggles, change the uniform, and then they can meet their family. Then they can sit with their family, and then they can have their meal with their family. It is also the responsibility of teachers to guide the students what they have to do at their homes to keep their family safe as well. To boost up your immune system and to have the strongest immune system nowadays is very important. There are some simple methods with which you can boost and you can maintain your immune system. Number 1 is to follow the proper hygiene. As I have mentioned before, that your personal hygiene should be at the best level. Increase the intake of fruits and fresh green vegetables in the form of salads. Get enough sleep at night time, not at the daytime, because the right time to sleep is night time. Do the regular exercise, simple light exercise on the regular basis. Stay happy and stay unstressed. Don't stress yourself. And if anyone at your home is in the habit of smoking, ask them to quit the smoking for the safety of other people around them and for the safety of their own self as well. And if there are any kind of immunized age appropriate vaccines, you should go for those vaccines, must and definitely, to keep yourself healthy and strong immune system. Thank you so much. Stay blessed, and may Allah keep us all safe from not only the coronavirus but from all kind of other disease and mishappenings. I hope all the teachers will practice these SOPs with the students, guide them properly and regularly, and be patient with the students to make them learn all these habits both in the school and in the home. Jazakallah khair, fi amanillah.